are common respiratory tract infections along with causative agents. Respiratory tract infections can be classified into lower respiratory tract infections and upper respiratory tract infection. Examples of lower respiratory tract infection: bronchitis, bronchiolitis, whooping cough or pertussis, lobar pneumonia, atypical pneumonia, pulmonary tuberculosis, fungal pneumonia, parasitic lung disease, lung abscess, pleural effusion and empyema. Example of lower respiratory tract infection: bronchitis, bronchiolitis, whooping cough or pertussis, lobar pneumonia, atypical pneumonia, fungal pneumonia, lobar pneumonia, atypical pneumonia, fungal pneumonia, pulmonary TB, parasitic lung disease, lung abscess, pleural effusion and empyema. Respiratory viruses causes bronchitis. Respiratory viruses causes bronchitis. Respiratory syncytial virus causes bronchiolitis. Respiratory viruses causes bronchitis. Respiratory syncytial viruses causes bronchiolitis. Bordella pertussis causes pertussis or whooping cough. Respiratory syncytial virus causes bronchiolitis. Lobar pneumonia is caused by pneumococcus, H. influenza, Staph aureus, Klebsiella pneumoniae. Lobar pneumonia is caused by pneumococcus, H. influenza, Staph aureus and Klebsiella pneumoniae. Atypical pneumonia by mycoplasma or chlamydia or viruses. Mycoplasma chlamydia viruses causes atypical pneumonia. Pulmonary TB by Mycobacterium tuberculosis. Fungal pneumonia by Pneumocystis cerevisiae and other. Fungal pneumonia by Pneumocystis cerevisiae and other. Parasitic lung disease by Paragonimus ascaris and other. Parasitic lung disease by Paragonimus ascaris and others. Paragonimus ascaris and others. Lung abscess, primary by anaerobes, secondary by gram-negative bacilli. Primary by anaerobes, secondary by gram-negative bacilli. Anaerobes and gram-negative bacilli causes lung abscess. Anaerobes causes primary lung abscess. Gram-negative bacilli causes secondary lung abscess. Pleural effusion and empyema by bacterial, secondary to pneumonia and tubercular and viral. Pleural effusion and empyema are caused by bacterial, viral and tubercular. Bronchitis by respiratory viruses. Bronchiolitis by respiratory syncytial virus. Whooping cough or pertussis by Bordella pertussis. Lobar pneumonia by Staph aureus, Klebsiella pneumoniae, Pneumococcus, H. influenza. Atypical pneumonia by Mycoplasma chlamydia and viruses. Pulmonary TB by Mycobacterium tuberculosis. Then fungal pneumonia by Pneumocystis cerevisiae. Parasitic lung disease by Paragonimus and ascaris. Paragonimus and ascaris causes parasitic lung disease by Paragonimus and ascaris. Lung abscess, primary by anaerobe, secondary by gram-negative bacilli. Bronchitis by respiratory viruses. Bronchiolitis by respiratory syncytial virus. Whooping cough or pertussis by Bordella pertussis. Lobar pneumonia by Pneumococcus, H. influenza, Staph aureus, Klebsiella pneumoniae. Atypical pneumonia by Mycoplasma chlamydia and viruses. Pulmonary TB by Mycobacterium tuberculosis. Fungal pneumonia by Pneumocystis cerevisiae. Parasitic lung disease by ascaris and Paragonimus. Lung abscess, primary by anaerobes and secondary by gram-negative bacilli. Pleural effusion and empyema by bacterial, viral and tubercular. Upper respiratory tract infections, pharyngitis and tonsillitis. Pharyngitis and tonsillitis is caused by influenza or coronavirus. Pharyngitis and tonsillitis, they are caused by influenza and coronavirus. Upper respiratory tract infection like pharyngitis, tonsillitis are caused by influenza and coronavirus. Laryngitis is caused by Streptococcus pyogenes, Clostridium Corynebacterium diphtheria, influenza and parainfluenza. Influenza, it mainly causes upper respiratory tract infection. Influenza, pharyngitis, tonsillitis is caused by influenza and coronavirus. Laryngitis is caused by Streptococcus pyogenes, Corynebacterium diphtheria, influenza and parainfluenza. Influenza, parainfluenza, Corynebacterium diphtheria, Streptococcus pyogenes causes laryngitis. Acute laryngotracheobronchitis. Acute laryngotracheobronchitis is caused by parainfluenza virus. Parainfluenza virus causes acute laryngotracheobronchitis. Acute laryngotracheobronchitis. Acute laryngotracheobronchitis is caused by parainfluenza virus. Acute laryngotracheobronchitis. Acute laryngotracheobronchitis is caused by parainfluenza virus. Acute laryngotracheobronchitis is caused by parainfluenza virus. Epiglottis is caused by Haemophilus influenza B. 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 Peritonsillar abscess by Streptococcus pyogenes, Staph aureus and anaerobes. Peritonsillar abscess and Ludwig's angina, polymicrobial and anaerobic. Polymicrobial and anaerobic causes Ludwig's angina. Upper respiratory tract infection, pharyngitis and tonsillitis by influenza and coronavirus. Pharyngitis, tonsillitis by influenza and coronavirus. Laryngitis by Streptococcus pyogenes, Corynebacterium diphtheria, influenza and parainfluenza. Influenza and coronaviruses, they causes pharyngitis and tonsillitis. Laryngitis is caused by Streptococcus pyogenes, Corynebacterium diphtheria, influenza and parainfluenza. Parainfluenza causes acute laryngotracheobronchitis. Parainfluenza causes acute laryngotracheobronchitis. Epiglottis by Haemophilus influenza B. Peritonsillar abscess by Streptococcus pyogenes, Staph aureus and anaerobes. Peritonsillar abscess by Streptococcus pyogenes, Staph aureus and anaerobes. Ludwig's angina by polymicrobial and anaerobic. Ludwig's angina by polymicrobial or anaerobic. Upper respiratory tract infection, example pharyngitis, tonsillitis by influenza or coronavirus. Laryngitis by Streptococcus pyogenes, Corynebacterium diphtheria, influenza, parainfluenza. Acute laryngotracheobronchitis, parainfluenza virus. Acute laryngotracheobronchitis by parainfluenza. Epiglottis by Haemophilus influenza B. Epiglottis by Haemophilus influenza B. Peritonsillar abscess by Streptococcus pyogenes, Staph aureus and anaerobes. Ludwig's angina by polymicrobial and anaerobic. Pharyngitis, tonsillitis, laryngitis. Acute laryngotracheobronchitis, epiglottis. Epiglottis by Haemophilus influenza B. Peritonsillar abscess by Staph aureus, Strep pyogenes. Then Ludwig's angina. Example of upper respiratory tract infection, pharyngitis, tonsillitis. Laryngitis, pharyngitis, tonsillitis, laryngitis. Acute laryngotracheobronchitis, epiglottis by Haemophilus influenza B. Peritonsillar abscess by Strep pyogenes, Staph aureus and anaerobes, and Ludwig's angina by polymicrobials and anaerobes. Pharyngitis, tonsillitis, laryngitis. Parainfluenza, influenza, Streptococcus pyogenes, Corynebacterium diphtheria. Acute laryngotracheobronchitis by parainfluenza. Acute laryngotracheobronchitis by parainfluenza. Epiglottitis by Haemophilus influenza B. Haemophilus influenza B causes epiglottitis by Haemophilus influenza B. Peritonsillar abscess by Streptococcus pyogenes, Staph aureus and anaerobes. Peritonsillar abscess by Streptococcus pyogenes, Staph aureus, and anaerobes Ludwig's angina, polymicrobial and anaerobic